Do you have pain in the front of your knee? Did you recently start a workout program? Or did the pain sort of come out of nowhere? Does it hurt when you run, squat, go up and down the stairs? Or after you sit for a long time? If the answer to these questions is yes, then you probably have a condition known as patellofemoral pain syndrome, and this video is for you. First off, anytime you hear the word syndrome, it means that there's a group of symptoms that consistently occurs together with no known cause. So in patellofemoral pain syndrome, the group of symptoms that go together are front knee pain that's typically hard to localize to a specific spot, that increases with running, squatting, and especially with going up and down stairs. In addition, we tend to find a specific pattern of muscle weakness in the legs. But we're not able to identify the specific tissue that's causing the pain. Radiological tests like x-rays and MRI typically don't show anything. There's usually no external sign of injury like swelling, discoloration. Patients usually feel fine at rest. But again, these patients tend to have quite a bit of pain with running, squatting, going up and down stairs. This condition most often occurs in young athletes. High school athletes are by far the most common group that develops this problem. The second most common group to be affected are military recruits. About 50% of recruits in basic training develop this problem. The first step in treating patellofemoral pain is to figure out the source of the problem. These patients generally fall into one of four categories. So category one, overuse. These patients have recently started a new activity like a sport, like that high school athlete I mentioned, or military training. And the tendons, muscles, ligaments, bones, joint surfaces just can't adapt fast enough to the increased physical stress. The solution is pretty simple in the short term. Back off on the frequency and intensity of training until pain starts to decrease, and then gradually ramp training back up. The second category of patients, those with muscle weakness. As I mentioned before, we tend to see a fairly specific pattern of muscle weakness. Typically, thigh muscles, quadriceps in particular, and hip muscles, side hip muscles, the gluteus medius muscle in particular. The next group, those with kind of bad coordination, these are athletes that tend to have their knee buckle inward when they're running or when they land from a jump. So the solution for these folks is coordination training. The last group, those with limited muscle flexibility, specifically the hamstrings, quadriceps, IT band, and calf muscles. And obviously the solution for these patients is a regimen of stretching exercises. The reality is most patients fall into a combination of these categories. What I'm going to concentrate on today is dealing with those patients with a strength deficit, because this is the most common. We find strength deficits in almost all of these patients regardless of category. And these are the exercises that I most commonly start with. Our first exercise is a banded mini squat. I say mini squat because we only want to bend the knees to about 45 degrees. The reason, if we bend beyond 45 degrees, the compressive force under the kneecap really goes up, and it tends to be aggravating for folks with patellofemoral pain. The point of the band wants to pull my knees inward. I'm trying to fight against that, right? We're trying to train away from the knees wanting to buckle in, okay? So, band tight, feet about shoulder width, squat to about 45 degrees, up and down. Keep it kind of slow, keep it controlled, and again, the big key is don't let the knees buckle inward, okay? So we'll do 3 sets of 10 to 15 repetitions. Our next exercise is simply a leg raise. We're targeting that gluteus medius muscle on the affected side. So laying with your back to the wall, heel of the affected side against the wall, simply raising up and down. The point of the wall is it keeps us honest. It keeps our movement into straight abduction or movement to the side. And that really maximizes the activity of that gluteus medius muscle. It's quite tiring actually. So if you could do about 10, maybe 12 repetitions of this, that'd be pretty good. The next exercise is simply balancing on the hurt leg. So you might need something to help with your balance, foam roller, countertop, something like that. Little bend in the knee, simply trying to balance for 30 or more seconds. Now, one thing to be mindful of, we don't, again, want the knee to buckle inward. Keep the kneecap kind of lined up with the tip of your shoe and simply try to balance. One thing I'll often tell patients to do is simply try to balance while they're brushing their teeth. So just do that twice a day. It's actually quite a long time to balance. You know, you're brushing your teeth for a minute and a half, 2 minutes. It gets quite tiring. So again, what we're trying to do is train away from that buckling in of the knee. And this is also a sneaky way to work those hip muscles that I mentioned in the intro. The last exercise is a banded bridge. And again, the point of the band is it wants to pull the knees inward, and our side hip muscles are having to fight that, okay? So band around the legs, knees a little wider than the hips. Simply lift the hips up, pushing through the heels. Hold for a couple seconds at the top of the movement, keeping that pressure, that outward pressure in that rubber band, up and down. So we're really trying to strengthen the side and back hip muscles with this movement. Up and down, 12 to 15 repetitions. So that's my phase 1 strengthening program for my patients with patellofemoral pain. I hope you found this video useful. I hope it helps you get back to what you love to do. Click those like and subscribe buttons, leave a comment, and we'll see you in the next video.